At Rocky Mountain Diabetes Center, certified diabetes educators have been a key contributor to the overall health care of patients for years. Certified diabetes educators help educate patients struggling with the daily challenges that accompany life with diabetes. People with diabetes need to follow careful nutrition guidelines, test blood sugar levels, exercise, and take medication on a daily basis. Initial and ongoing education helps patients navigate through the maze of information, including exciting new technologies that can simplify life with diabetes. At Rocky Mountain Diabetes, our certified diabetes educators are an amazing support to our patients. Things are changing in diabetes education, and responsibilities are expanding. In fact, in 2019, the profession title changed, and as a result, the Certification Board modified the CDE credential to CDCES. The progressive change from a certified diabetes educator to a certified diabetes care and education specialist is significant. So what's the difference? Let's take a look. Formerly, the CDE credential was focused primarily on education. Over time, the evolving realization was that CDEs were doing much more than providing education. They had become caregivers.
Diabetic educator has been more like a caregiver because she has really looked out for me when I was choosing a new pump, because I had been on a study for 2-3 years and my old pump had died, so we didn't know which direction to go, so she really helped us in choosing a new pump.
We could ask as many questions. She also showed me how to put it in, and she let me do it instead of just being like, you do it like this, and then me later having to watch a video.
The change in credentialing now more appropriately reflects the healthcare services that are also provided by diabetes educators and bridges the gap between an education-only perspective to the more expansive scope of specialization in diabetes care. For example, certified diabetes care and education specialists provide support and problem solving, answering patient questions like, how do I handle eating during the holidays? Or, what do I do if I'm doing everything the doctor told me but it's not working? CDCESs help patients work through these types of questions and enhance problem solving. They also provide assistance with the latest technologies that are available, like continuous glucose monitoring devices and insulin pumps.
They're usually staying up on the most current devices that are available. They know how to apply them, they know the uses of them in certain situations, certain patients, what's approved in certain patient groups. They know the compatibility between the different continuous glucose monitors and the insulin pumps, because they're not always compatible. And so they find that they really do know that the tech, which is always evolving, every year there's almost something new coming out.
There's a role for diabetes educators and those who are brand new diagnosed with diabetes, because it's all new and it's often frightening, and there's lots of false information that they really can help to make this a much more safe diagnosis and hopeful diagnosis. Diabetes is not the death sentence it used to be. When well managed, our diabetics will live long and healthy lives and really quite normal lives.
Patients often ask when it's the best time to request an appointment with a certified diabetes care and education specialist. There are 4 critical times. First, upon diagnosis of a diabetes-related condition. Second, along with the annual exam. Third, when new challenges present themselves. These may include medication adjustments or any physical, emotional, or financial challenges. Finally, anytime there are changes in the patient's healthcare team, including insurance coverage. These changes could be due to a move or transitioning to a new physician. If you or a member of your family is struggling to find a good quality of life with diabetes, give Rocky Mountain Diabetes Center a call and request an appointment with one of our certified diabetes care and education specialists. We provide the care and hope of a fruitful, high quality of life, even with diabetes.